before we start the presentation, I would also like to appreciate the committee chairperson in person of Mr. Emmanuel Adewoyin. So without much ado, I would like to welcome Mrs. Precious Ogbogo to do the opening and welcoming acknowledgement of the attendees. Mrs. Precious, you have the floor.
Thank you very much, Mr. Aliyu. Good morning, good afternoon, good evening, distinguished guests, esteemed colleagues, and fellow healthcare professionals from Nigeria and around the world. We want to welcome you to today's webinar organized by Sterilization and Infection Control, TORG. Like the moderator rightly said, introduced, my name is Precious Ogbogo, the secretary and also the PRO of the committee, TORG. It's an honor to welcome you to our webinar this evening, and the topic is going to be focused on innovations in sterilization and surgical instrument maintenance, enhancing patient safety through SHARP and STERI programs. And our speaker, K. Myers, will be delving into cutting-edge innovations in sterilization techniques, surgical instruments, maintenance, and safety protocols. Today, we want to come together to share knowledge, expertise, and best practices in advancing patient safety and care. And as part of TORG network, we are committed to raising healthcare standards, particularly in developing regions like Nigeria. And our committee plays a vital role in promoting modern sterilization techniques and equipment in hospitals, ensuring the highest standards of hygiene to prevent infections and improve patient care. Our webinar this evening will explore cutting-edge innovations in sterilization techniques, surgical instruments maintenance, and we'll be introducing a program this evening, which is SHARP and STERI program. This program entails safe handling of surgical instruments and prevention of injuries in the operating room, and also standardized protocols for sterilization, disinfection, and instrument maintenance through our expert presentation, discussions, and knowledge sharing. So we'll be working together tonight to enhance patient safety and care. I'm confident that this event will foster meaningful collaborations and also equip us with practical solutions to implement in our respective healthcare settings. So please, I would like us to feel free to engage in the discussions, and also feel free to use the chat box to submit questions and contributions during the presentation, as our speaker will address them after the presentation. Let's work together to advance this future of healthcare, especially in Nigeria and all over the world. Once again, we want to welcome you all to our webinar tonight. Thank you so much for joining us, and we hope to have a wonderful deliberation. Thank you so much. Mr. Danjuma, please. You have the floor, sir. Thank you.
Thank you very much, Mrs. Ogbogo, for that wonderful opening remark. The next item on the agenda is the reading of the bio, in the introduction of the guest, and the reading of the bio of the today's speaker. and that will be anchored by my humble self. Mr. Miles is the founder of the Safe Surgery Initiative, a non-profit organization, and the Chief Executive Officer of Safe Surgery Innovation, a social enterprise dedicated to improve the safety and quality of surgical services in low-resource settings. Through the Safe Surgery Innovation, Mr. Miles addresses critical challenges faced by healthcare providers by leveraging on innovations and technology, focusing on sterilization, surgical instrument refurbishment, and surgical devices management. With 20 years of experience in the surgical device industry and working for STERI, he developed deep expertise in surgical technology and healthcare system. The journey towards surgical site infection began after our founder witnessed firsthand the unsafe condition of surgical tools used on patients while volunteering in Benin. It was a transformative experience that created our mission to provide safe surgical equipment to low and medium income countries. Mr. Miles holds a Bachelor of Arts degree in International Studies from the University of Alabama in Birmingham. He is an active member of several professional organizations, including the Association for Advancement of Medical Instrumentation. The second one is the Association of Surgical Technologies, the Association for Professionals in Infection Control and Epidemiology, and the Society for Gastroenterology, Nurses and Associates. Like I've said, today's presentation is on innovations in sterilization and surgical instrument maintenance, enhancing patient safety through SHARP and STERI programs. Please, let's engage in a proactive discussion and permit me to welcome Mr. Miles to the floor. Mr. Miles, the floor is yours.
Thank you. Thank you. Thanks everyone for that, for the invitation, and as well as for the wonderful introduction. We really appreciate having the opportunity to speak to the TORG members. We are very excited for this webinar, and I'm excited to present it for you all today. Let me just share my screen and we'll get started. Can everyone see my screen?
Yes, sir, we can see your screen, sir.
Okay, perfect.
Yeah.
So today we're going to be discussing innovations in sterilization and surgical instrument maintenance, and how those programs enhance patient safety, especially in low to middle income countries. Our mission at Safe Surgery Innovation is to reduce preventable surgical complications by equipping healthcare professionals with the tools and training they need to deliver safe, timely, and affordable care. We do that through several different types of programs and categories. One of those programs being sterilization technology and infection control, surgical instrument maintenance and repair, surgical device management and consulting, and biomedical capacity building using technology and education. Our main programs that we run at Safe Surgery Innovation is our SHARP program, which we'll be discussing in detail today, as well as our STERI program revolving around reprocessing of surgical instruments. Our other programs include surgical device management and consulting and bespoke training services where we develop unique training programs for biomedical technicians in low resource settings. That could be anything from teaching them how to repair surgical devices like dermatomes or ventilators, or endoscopes, all the way up to oxygen plant generation. So setting up an oxygen plant at a hospital,
Can I
how to
say
maintain
something?
that equipment going forward.
You should share your full screen. Can
Oh,
you please share your full screen?
Sure, give me 1 second.
Okay, thank you.
Just go back. Got me a lost that.
Because someone is using someone is joining this webinar on the phone, so they might be having some problems to seeing. So it's better if you will share your full screen. Okay. Thank
Okay,
you.
give me 1 second.
Thank you in advance. Okay.
That looks a little bit better. Is that better?
Yes, that's okay. Thank you. Yes, we can start.
Okay, all right. So, as I was saying, overview of our programs include the SHARP and the STERI, which we'll be going over in greater detail, as well as our surgical device programs and surgical device management and consulting, and our bespoke training programs, which I briefly went over in details. Surgical site infections account for up to 20% of hospital infections in low to middle income countries. It's a huge issue that we all face on a daily basis. And some of the reasons for that is because of poorly maintained or unsterile instruments as a major contributing factor, as well as the type of chemicals we use to reprocess those instruments. One of the things we try to do to minimize the surgical site infections at these hospitals is through training and innovation by improving the safety and the quality of the instrumentation. So let's talk about SHARP. SHARP is the first interactive training program for surgical instrument repair in the world. It was specifically developed for low to middle income countries with low resources and minimal access to surgical device manufacturers and their repair services. It teaches participants how to maintain, refurbish, and extend instrument lifespans. One of the problems or issues that we normally see in low resource settings of developing countries is the lack of understanding on how to maintain surgical instruments and also how long those instruments are supposed to last. Most instruments are manufactured to be repaired and refurbished over and over again until it reaches its end life use. That means that when an instrument gets dull, it needs to be sharp. When a forcep gets misaligned, it needs to be adjusted back. So they're designed and developed to be maintained and refurbished for years and years and years, providing safe quality care on each patient, which is extremely important when you have low resource settings because you don't have as many resources available. So you have to make sure that you're maximizing every piece of equipment, every instrument to give the best quality of care. So this program is ideal for health ministries, NGOs, and OR staff working in low resource settings. An overview of our program, of the SHARP program, includes how to professionally inspect, repair, and maintain surgical instruments. We go through different types of instruments in that entire process. So everything from inspecting the tips all the way down to the proximal ends of any type of surgical device. This program was developed by industry experts and it comes with a industry recognized certificate upon completion. It's broken down into detailed step-by-step videos, virtual lab exercises, interactive learning experiences to make the program not only informative but also engaging as well. The overview of the SHARP program curriculum includes, it teaches how to do basic instrument repair. So all the way from the types of instruments, the different type of materials used to manufacture surgical instruments, and how to look for signs of damage and wear. Another part of it is going to go through your instrument and maintenance, looking for spots, rust, and misalignments, and also all of the exact protocols and functionalities for doing any type of surgical instrument repair and refurbishment on that instrumentation. A breakdown of the SHARP features, when we look at how we developed this program, we thought about what are the ways that are going to be more engaging for the students or for the participants. And so the program is broken down into 4 weeks of online training, 4 weeks of practical training, and then 4 weeks of evaluation. So the way the SHARP program works is your first 4 weeks is going to be all online training. You're going to go through all of the different training programs, the different tutorials, and then after that, once you've completed the first step, then you go on to the second phase, and that's 4 weeks of practical training. So you're going to get all of the, that's when you're going to start practicing and going to all of that dedicated steps and procedures on how to properly refurbish surgical instruments. Once you finish the practicals, then you go into your 4 weeks of evaluation, where we will evaluate remotely all of your instruments and repairs, and then finally taking your final exam, and from there you get your completion and certificate for instrument maintenance. The toolkit was designed for low resource settings. So the toolkit comes with over 50 tools, and they're rated to last over 10 years. And so we wanted to make sure that the programs would be sustainable for the long term. And so making sure that the tools that are inside of the kit are going to be reliable and they're going to last the hospital for an extended amount of time. So with proper storage and maintenance and care, the tools that you need to sharpen and align your surgical instruments will last for over 10 years. And on top of all of those different added bonuses for the SHARP program, it also includes, as I mentioned, the certification, but we also give the hospital and the trainees the ability to track all of their surgical instruments and devices, as well as financial reporting. And so inside of when participants are enrolled into our SHARP program, they're also enrolled into our Safe Surgery Institute. And the Safe Surgery Institute is where we have all of our educational programs for the hospital. So if you wanted to learn how to do specific training on certain type of devices, certain types of pieces of equipment, different sterilization protocols, you can learn that all in the Safe Surgery Institute. And from an administrative standpoint, from a hospital perspective, when they sign up for any of our programs, they're also enrolled into the Safe Surgery Institute, and so they're able to track your progress. They can track the repairs. They can track when things are needed for preventive maintenance. So we also set up a preventive maintenance program for the hospital that comes with our SHARP program. It's been designed for low resource settings to train staff and keep that maintenance in-house. And so one of the great things about the SHARP program and what Safe Surgery Innovation does as a whole is that all of our programs are designed for low resource settings. So we know that you have to do more with less. And so how can we extend the life of the equipment that's already at the hospital is very important, and maintaining the functionality is going to increase patient safety and overall OR efficiency. So one of the things the SHARP program does to help maintain that skill level at the hospital is that for each hospital that signs up for SHARP, they get 2 technicians or 2 participants signing up to that program. If a few years later, one of the participants leaves, then the hospital can enroll a new staffer free of charge. That way, no matter what happens, that the hospital will always have technicians available, at least 2 at any given time, who can maintain their surgical instruments going forward. Another good feature of it is that it's fully remote accessible for underserved countries. So in areas where you have low internet connectivity or spotty internet connectivity, you also have a downloadable a step-by-step guide for instrument maintenance that'll be on a thumb drive, so that you can easily connect it to your phone or you connect it to your computer. And if you had any questions while you were offline, you were able to kind of go back to those resources and have those things readily available. When you're able to maintain your surgical instruments, that's going to produce less waste for the hospital, lower costs, and improve trust. Because when surgical instruments are functioning properly, you're going to have shorter case times. You're going to have increased OR efficiency. Which is going to increase patient outcomes. And when you have improved outcomes, you get improved trust in the community, because you're getting less complications due to instrument quality or surgical site infections or things or prolonged wound care, things that would make a negative impact on patient recovery. Because a lot of those things are related to the quality of the instruments and as well as the sterility of those instruments that are used on the patients. So that's a brief breakdown of what SHARP does. And now we're going to go into talking about our sterilization program, certification program. The STERI program is online certificate program for sterilization practices. It's tailored for low to middle income countries, and it addresses the infrastructure gaps that those countries have. And when I talk about infrastructure gaps, I'm talking about lack of power for your autoclaves. We're talking about looking at sterilization, accessibility from a supply chain standpoint of getting the right consumables and the right processing chemicals for sterilization. All of the STERI programs, all of the STERI knowledge and training aligns with the WHO and international standards. Because when you look at it, it's all connected. Everything that happens in regards to safe surgery all stems from sterilization. If you don't have sterile instruments, you can't have safe surgery. Surgical site infection goes up, wound care goes up, complications goes up, and cost goes up when you don't have properly clean, sterilized tools. The curriculum includes infection prevention principles, instrument processing, which is cleaning. How do we clean instruments properly? Simple things like letting blood and saline dry up on instruments, not taking instruments directly from the OR room after a case and then taking them directly to reprocessing, which it could be decontamination area where the instrument is going to be clean. All of that bioburden is going to remove off those instruments. It's vitally important for the instruments to have that bioburden removed and washed off as soon as possible. Blood is corrosive to metal as well as saline. So we want to make sure that we are cleaning those instruments also timely and efficiently. It covers all common known sterilization techniques, whether it's steam, ETO, or plasma, to make sure that no matter what type of sterilization techniques you're using, you'll have the skills and knowledge to perform those tasks. Depending on the type of equipment you're using, for instance, endoscopes are not steamed in an autoclave. Different types of surgical devices don't go through the same process. And so we want to make sure that whether it's steam, whether it's ETO, whether it's plasma, you'll be able to process any type of, sterilize any type of surgical device without causing any damage. The features of STERI include interactive gamified learning with expert mentorship. It includes webinars, libraries, and other resources, and it also has continued education. Because when you sign up for STERI, it's not just signing up for for one type of program. It's a certification and membership into the Safe Surgery Institute. When you sign up for STERI, you'll have to renew that certification once a year. Each year, we also provide free CEU credits for education purposes. So their standards as advancements in sterilization techniques improve, we'll update those into our Safe Surgery Institute, and you can go on and get continued education credits for that for those modules. It's designed for offline and online use. So there's an app that's associated with the STERI program that you can download, and you can proceed to go through that training program while you're offline, and then you would just upload your results once you're back online. So it gives a more accessibility for hospitals and limited connectivity areas around the world. So benefits of these programs includes better outcomes with lower SSI rates, cost effectiveness of operation with fewer equipment failures, and then scalable and sustainable training modules. And so I want to talk a little bit more about infection rates. Normally, infection rates, and as I mentioned earlier, are 20% higher in low to middle income countries. But we also have to take into account that we also have a lack of data in regards to those rates could be much higher because of the lack of data that we currently exists. I can't stress how important it is of having properly sterilized medical equipment, whether it's an endoscope or a operating room microscope or a dermatome. When instruments are reprocessed properly, that can increase not only safety issues for the patient, but it can also lead to equipment failures. If you reprocess, say, a endoscope and you get fluid evasion, well, that's going to cost a lot of money to repair. And so we want to make sure that when we're reprocessing instruments and devices, that we're not breaking them in the process. Traditionally, 70% of equipment failures come from reprocessing when it comes to medical devices. If you don't follow the manufacturer's IFU, which is the instruction for use, when it comes to sterilization, you will cause a lot of damage to that equipment, and it's very costly to fix. And then it will cause, which leads kind of have like a trickle down effect for patient safety, because now the equipment's broken, now we can't do the surgery, and it has this cascading effect for our ability to provide timely surgical care. And the great other thing about the program is scalable and sustainable training models. So we developed these programs to be very accessible for low to middle income countries. So for a hospital in, say, Nigeria, you could train one nurse in STERI, one nurse in SHARP, and that STERI technician now becomes a leader, a trainer at the hospital, and she can or he can be a champion for improving the quality of the reprocessing of surgical instruments and devices, and a champion to train other technicians at the hospital. So it's not a situation where you have to have every OR nurse or every OR professional at that facility taking a STERI certification. It's great if they do, and we definitely encourage it, but we also look at it from a sustainability model, like how can we do this and make sure that it's more accessible, because we want the knowledge to get out there, and we want as many people to understand these processes because of how important it is for patient care in these environments. So it's always great to know what you can get out of these programs. So now what I want to do is kind of just briefly go through our surgical instrument and inspection guide, because it's always great to see what the programs are, what can I learn from it. And so this is just a small snippet of how important these programs are and the benefits that you can have from engaging and learning from them. So we're going to go through briefly with the time that I have available through this surgical instrument inspection guide. I'm going to show you how just learning how to inspect surgical instruments can improve the quality of care at your hospitals. Because one of the most important things when it comes to surgical instruments and surgery in general is surgery is all about precision. Things have to be precise. When the surgeon gets an instrument, he or she is expecting it to cut properly. They're expecting to grab, they're expecting it to function in a certain way, which is properly. If it doesn't function, then they have to do all these different adjustments to the instrument or to the patient to get it to work properly. So it's very important and very vital that instruments are inspected beforehand. So it's not the surgeon who's telling the OR nurse, this instrument isn't cutting, and so a lot of times we find ourselves in the situations where we have instruments that are not functioning properly. The surgeon complains about it, hands it over to the nurse, and then nothing else happens because no one knows how to properly inspect the instruments, and no one can go back and say, okay, well, based off WHO guidelines, based off the IFUs of the manufacturer, these are the inspection points. These are the things that's wrong with it, and it's not safe to use. So having that knowledge in mind will empower OR professionals to say, hey, this is unsafe, and these are the reasons why. And so when you have that, then you can go to your administrator and say, these are the reasons why it's broken. These are the reasons why the things need to be replaced, and we need to get an order or find a new piece of equipment. So that being said, if you don't have the ability to test and inspect instruments, then there's no way to do that quality control before it makes it to the patient. And so as much as possible, anyone who comes in contact with that surgical instrument as it gets reprocessed through the hospital should know how to inspect it for damage. The more people in that cycle who knows how to test surgical instruments, the more safer they're going to be, and the less likely it will be the surgeon telling the OR professionals that this instrument is not working properly. So with that being said, we'll just briefly go through some of the inspection points for a scissor. It doesn't really matter the type of scissor that you're looking at because the inspection points are going to be general based off the functionality of the instrument. So just for starters, we always want to make sure that we're looking at the distal tip of the instrument. So that's going to be the tips where the blades meet. So we want to inspect those tips to make sure that they're meeting properly. We want to inspect the blades on the inside for cracks or bile burden. You also want to slide down to look where the screws meet and make sure that there's no cracks in that area. Normally, when it comes to surgical instruments, if you have a screw or any type of piece where two parts of a instrument meet together, that's normally the stress point, and then that's where you're more likely to see cracks and things like that. A good way to determine if an instrument has any cracks in it is look for signs of rust. Rust and staining normally means there may be a crack on that instrument. So then you want to go down and make sure that you have a smooth action, which is the opening and closing. If a scissor is too loose, then it won't cut properly. If it's too tight, then it's going to cause a lot of hand fatigue for the surgeon, and it's going to grab tissue instead of cutting the tissue. So we always want to make sure that we're going through each one of these inspection points. Next, we have the hemostat. Some people call them hemostats. Some people call them Kellys. I normally call them clamps. But when you're inspecting your hemostats, you always want to make sure to start off at the tips. You want to work your way from the tip of the instrument all the way down to the proximal end. The tips sometimes may get a misalignment. Sometimes there's different types of hemostats have different type of tips. So sometimes it has teeth, like in a dressing, or a tissue forceps. So once you check that, you want to open the instrument up and look on the grooves. See if there's any kind of blood or dry blood or bile burden or tissue left over from the last patient or the last reprocessing. So you want to check in those grooves to make sure there's no bile burden inside of there as well. And then also going down, looking at the clamp area right here to make sure there's no cracks or anything like that. Next, you want to test the ratchet. That's going to be down at the bottom with the rings. And then you want to make sure that it's engaging properly into that first and second ratchet. That's going to make sure that when the surgeon closes that instrument, that it's going to stay closed and it's not going to spring out while you're in the process of doing surgery. Another instrument to look at is a needle holder. Needle holders come in two types. Some have a gold handle, and some have a regular satin finish handle. If an instrument has a gold handle on it, that means it has a tungsten carbide insert. Tungsten carbide is stronger than stainless steel, and so they normally put that into scissors and different types of instruments to make it stronger and hold a sharp edge longer. And they're normally the more expensive version of that equipment. Most needle holders will have an insert on the inside of it, and you want to make sure to check that insert to make sure that it's present and that there's no cracks, there's no signs of wear. If the inside of the insert is smooth, then it's most likely not going to hold that needle, and it's going to spin and not grip properly. So you want to make sure that any of the needle holders that you have in your set, you're able to test those properly prior to surgery. Next, we have a forceps. Like I said before, I normally generalize these instruments into just categories. So we have a regular forceps. Again, you want to make sure that you're looking at those distal tips to make sure that that it's not misaligned, and then also making sure that there's no blood or bile burden. Most of these forceps will have some type of serration on the inside, and so you want to check those serrations to make sure that there's no residue left over. You also want to make sure you go down the handle area where the grooves are to make sure there's no bile burden there. A lot of times in that part, you'll get a lot of rust. Because that's normally where the surgeon is going to be holding it, so it's going to have more contact with blood and tissue from the patient. You also want to go down to the bottom end and make sure that you're inspecting that area for cracks. You'll see a lot of rust and pitting start to form in this area over time. Now we have an elevator. Elevators are normally used in orthopedic surgeries. And so elevators normally come with what we call a soft edge. That soft edge is slightly sharp, but it's not like a razor edge like an osteotome. So you want to do a visual inspection from top to bottom, preferably primarily focusing on the distal end. The space is going to come in contact with the patient. So always making sure that there's no nicks, burrs, or damage to this area. If you see that, then you need to remove it out of service and replace it with a different instrument. Same thing with your osteotomes. They're pretty straightforward inspection points. Always paying a good focus to that distal tip up here to make sure that there's no nicks, burrs, or damage to that area. And then you also want to turn it on the side and make sure that the edge is meeting properly. Most osteotomes normally kind of come up in this steeple kind of position. So when the angles meet, they should kind of meet at that 90 degree. Gouges, similar thing when you're looking at surgical instruments, and you can kind of notice so far as we're going through these different type of surgical instruments, and you notice that the inspection points are very similar, say from a gouge to a elevator and to a osteotome. And so that similarity is how we develop some of our refurbishment techniques when it comes to surgical instruments. So in the SHARP program, when you learn how to fix one type of instrument, it'll show you how to fix other types of instruments as well based off the designs of that instrument. So if you have, say, if you know how to sharpen an elevator, you will also know how to sharpen a gouge. You know how to sharpen an osteotome, or you know how to sharpen a chisel, just because of the different layouts and techniques of those programs. And that's the same when it comes to inspecting surgical instruments. Once you learn the basics of how to inspect surgical instruments, you'll be able to inspect any type of surgical instrument, regardless whether they were in this list or not, just based off how the instrument is used and how it's designed. So based off the design of the instrument and the usage, you're able to take that information, and then you can analyze any type of surgical instrument and know how to inspect it based off those different parameters. Same thing with the curette. We'll just kind of speed through these a little bit quickly. So the curette has the same issues, making sure that you're checking those distal tips and make sure that there's no signs of damage and wear. Trocar, same thing. Trocar has 3 different edges, and so you want to make sure each edge is inspected and tested for sharpness. So your run drawers. Now we're in a different class of instruments. Run drawers are normally used in orthopedics and neuro and several other specialties. You always want to make sure that the jaws are meeting evenly, checking for signs of damage. You want to inspect the edges for damage as well. Another important thing, you want to make sure that each of the screws in that run drawer are present and that they're not loose. If you ever find a run drawer and it has a loose screw in it, that needs to be taken out for repair. Ideally, if you're enrolled in a SHARP program, then you will be able to just tag that instrument and then repair it in your normal process. You also want to go down to where the springs meet, and you want to check those springs and make sure there's no damage, and make sure that the springs are present. A lot of times with these type of instruments, these cracks will form kind of near the screw area, and so that spring will break off. So you want to make sure that they're connected. There's good tension, and then also that they are there's no cracks or springs on that instrument as well. The same thing with a bone cutter. You have very similar inspection points. As you can see in this picture, this bone cutter actually is missing a screw, and is also the springs are not aligned. So I put this in as an example to kind of see how an instrument could look in your facility if you're not going through the inspection process. As again, you're going to go through looking at springs, inspecting the springs for fit, checking for cracks, just like you would with the run drawer. Pin cutter, the same thing. You want to make sure that pin cutter is meeting evenly. As you can see, here's another example of a broken instrument. So you can see there's an insert on this instrument, and it's broken on one side. So you want to make sure that all inserts, all parts, all screws, and everything on that instrument is functioning and present before handing it over to a surgeon or before reprocessing. When you're going through the cleaning process, that's the best time to inspect your instruments, either after the cleaning process, and then also during the reprocessing when you're preparing that instrument for sterilization. Here we have a retractor, Wayland retractor, self-retaining retractor. This is very important that we inspect these instruments because they are used to gain access to the surgical site. And so if this instrument malfunctions while doing surgery, it could cause a lot of damage to the patient when that surgical site is then closed up or use of it has been limited. So we want to make sure that these retractors are inspected properly. You want to inspect the tips. You want to inspect the screw area for cracks, as well as checking the ratchet area in this lever as well. So that lever on that Wayland retractor should open and close as you open and close it, and it shouldn't get stuck. If it does get stuck, then you want to make sure that you're taking it out and replacing it with another retractor. Here we have a grasper. Sometimes it's called a pituitary grasper, the different versions of it. But as you can see, we're going through similar inspecting points. You know, we're looking at the jaws, we're making sure they're meeting properly. We're going along the shaft of the instrument, make sure there's no signs of damage and wear. We're looking at all of the articulating parts, all of the moving parts that should open and close, and how they interact with the distal side of the instrument. And so you want to make sure that you're checking all of these different inspection points to make sure that that instrument is going to be functioning properly during surgery. Same thing with the kerosene. These kerosenes are very notorious when it comes to inspection. You want to make sure that you're doing your due diligence and cleaning these properly, because as you use these instruments, blood and tissue can go down the shaft of that kerosene as they're using it to remove tissue during surgery. So we want to make sure that these are getting cleaned properly on a regular basis. And a good way to do that is maintaining a good functional instrument by going through these inspection points before surgery or after reprocessing. So you inspect that cutting edge, you want to inspect the springs, and then you want to inspect the screws to make sure there's no cracks in it. Same thing with the biters. Biting, this could be an ortho punch, it could be a biter, it could be called by a lot of different names, but the inspection points are pretty much the same, regardless of the type of instrument. Once again, you want to look at those distal tips, checking the jaws, making sure they're meeting evenly, inspecting for cutting edges, and then inspecting both sides for cracks. And then also always making sure that when you open and close that instrument, that it's open and closing properly. So that's just a brief breakdown of our surgical instrument inspection guide. It goes into a lot more detail during the program, which teaches you how to actually test those instruments. So during this little brief discussion, we talked about how to inspect, so doing visual and tactile inspections of the instrument. But then there's also another side of that where you're actually able to test the instrument for functionality. So being able to use the right type of testing materials to test each one of those types of surgical instruments. What the SHARP and STERI program both do is not only do we teach you how to use the IFU testing standards, but we also teach you how to use alternatives that are locally readily available in your environment. For instance, so instead of using the standard testing material for a scissor, which is a latex resistant band, you can use a surgical glove or a surgical gauze. So depending on what you have available, you can use those different type of things. So for each category of surgical instrument testing, there's an alternative, locally available resource that you could use to perform those tests. So in conclusion, SSIs are a critical threat for hospitals in low to middle income countries. SHARP teaches effective instrument maintenance and repair. The STERI programs, advanced sterilization and certification. As I mentioned, safe surgery is all about global access for safe surgical care. And one other thing to mention is that for TORG members, we are an official member partnership with the TORG members. And so any TORG member gets a discount on any of the programs we currently have running for SHARP and STERI. So please reach out to the coordinators and they can get you the information in regards to those promo codes. Thanks everyone. I look forward to a lively discussion and I'm ready and happy to answer any questions. Thank you.
Okay. Thank you very much, Mr. Kemas, for.
Thank you.
Are you there?
Yes, can you hear me?
Mrs. Florence. Okay, if she's not online, please, I would like to invite Mrs. Precious Ogbogo to go ahead and anchor the question and answer section. Mrs. Florence. Precious, sorry, Mrs. Precious.
Okay, I think she's online.
Okay.
Can you hear me?
Yes, we can hear you.
Yeah, yeah.
Okay. Good evening once again. I want to appreciate Mr. Max for such an impactful presentation. And I've already put on the chat that people should start dropping their questions in the chat box so that he will attend to them. Hello, Mr. Miles, can you hear me?
Yes, yes, I can hear you. Yes.
I guess there are some questions already in the chat.
Okay, sure.
Please, man, go ahead and just pick it out for him so that I can attend to them.
Yes, please just read the questions out to me and I can answer them as they come up.
I think she's having some network hitches. Someone is asking.
Mrs. Precious, please go ahead. Go ahead and.
Okay, this is from Ashad Ali. He is asking, what about protocol? If I sterile sets, I don't know, I don't understand what he or she is trying to say here, but if I can deduce, I think he's trying to ask the protocols of a sterile set of a wrapped paper that consider the process. I really don't get the question, but let me read it as he typed. What about protocol if I sterile a set their wrapped paper? Is that considered process or recall process? 2, please also inform about recall process. I think he's trying to understand the difference between a wrapped paper, if it's considered a process or a recall process. So I think that's what the person is trying to ask, but I don't know if you can get the question.
Okay, I'll try my best to answer that. I am a little bit confused on it, but I think what he's asking about is if your instruments are wrapped properly for sterilization, normally there's some sterility assurance indicators that you should include into that wrap. So, for instance, that could be something as simple as indicator tape that you wrap around the cloth before you put it into the instruments. That's the very basic way of ensuring that the temperature has been met for sterilization. So each type of sterilization cycle instrument requires heat, pressure, and time. And so the pressure needs to be at a certain point to have proper sterilization. And then it also has to have a certain amount of contact, that's where the time comes in. And then it has to have that temperature. And so it has to stay at a certain temperature for a certain amount of time. And those indicators, the indicator tape will tell you if it meets that temperature requirement. If you wanted to take it a step further, you will also include a sterility indicator strip that will go inside of that, go along with those instruments, and it will have like a sample of a biological sample that will determine if it reaches full sterilization. So that's I think that's what he's talking about when he's talking about like recall. So if it didn't meet those standards determined by the indicator, then you could also remove it. Another good way to do it for if you don't have all of those different type of indicators is that anytime you open up surgical instruments set that's been sterilized and it's wet, we call it a wet load, then you know it hasn't reached sterility. So if you're opening up a set, say you're in an OR and you open up a set and you're getting ready for surgery and you can see residual water that's still wet in that set, then you know for a fact that it didn't reach sterility. And then that's a way to kind of, without having all of those other indicators, to know that is not safe for the use. And so you should replace it with a different set.
All right, thank you very much for the response. There's a question here from Abigail Beatrice. He's asking, how long should instruments be used?
So that's a great question. So instrument usage is not a straightforward easy answer for that. So basically, it's all about functionality. So you should use the instrument as long as it's functional and as long as it's safe. And so if you take just a brief, if you only took what we talked about today, as far as like inspections, you could be able to make that determination. So it basically, if it fails any of those tests that we previously discussed, then it's no longer good for you. So it's not really a matter of time. I've seen surgery instruments that are 30, 40 years old that are still functional. When I worked in the private sector, we normally would like put a date stamp on instruments and when we repair them. And I've seen instruments in Kenya, I've seen instruments all over the world that are older with old date stamps saying that it's at least 10 or 15, 20 years old and it's still functional. So it's not really a matter of time. It's all about how they're being cared for and if they're being refurbished.
All right. This question is from Ernestina Jonah. He's asking, how do we sharpen scissors in a low resource setting?
Okay, so the way you sharpen the scissors in a low resource setting is to enroll in the SHARP program. It is the only program available that will teach you how to sharpen an instrument in a low resource setting, whether it's a scissor or osteotone or a kerrison, and it teaches you how to do it no matter the difficulty of the instrument. And so that's the short version of that answer, and that's the best thing I could give you at this point. But enrolling in the SHARP program is the only way currently to learn how to repair surgical instruments in low resource settings.
Thank you. Laditri Maurice is asking, how can we sharpen blunt instrument? He is also asking, how can we sharpen blunt instruments in low resource settings? And the second question is, what kinds of sterilization methods can be adopted in a remote settings?
So the second question, the sterilization method is for a remote setting normally revolves around thermal sterilization. So that's going to be steam. Sometimes they use everything. It could be something as advanced as a completely automated autoclave sterilizer, or it could be a small kind of portable kind of those portable sterilizer, kind of tabletop portable sterilizers, which are basically like a modified pressure cooker. I've seen a lot of those in low resource settings where they use those to sterilize their instruments. So those would be the methods that are used in those remote areas.
Thank you for the response, sir. The next question is from Oluwatoyin Helen Joseph. She is asking, what steps are put in place to prevent fake surgical instrument production by manufacturers? It affects the safety and durability of the instruments and surgical outcome.
Yes, so those are a great question, and I know exactly what you're talking about. I have seen, especially over the last 5 to 10 years, an influx of fake surgical instruments. And then what I mean by fake surgical instruments is that you're seeing a lot more instruments coming out of Pakistan that look like high quality surgical grade instruments. So one of the ways to determine if an instrument is actually officially from, say, like Europe or America, specifically in Europe. In Europe, the instruments get a CE mark. Every medical equipment in Europe gets a CE mark, so that's a standard. So whether they're selling it in Germany or they're selling it into Nigeria, all of their instruments are going to have that CE mark on it, and so that mark will let you know if it is from that particular place. But I would also take it a step further, and normally it should have like the manufacturer's name on an instrument as well, a model number, and some other information. If you don't see all of that information on the instrument, then it's probably a forgery, and you could take it a step further just by Googling the name on that's listed on the instrument, and then find out which country it's coming from. I actually had a situation in Ghana where I had to do that, where I had to track down the manufacturer because the manufacturer name listed. I know the quality of the instruments, and the instruments that we had from that fake manufacturer, they were all breaking fairly just by, if you drop it on the ground, it would shatter. So there's been a lot of cosmetically where they make the cosmetically looks like a high quality instrument, but it's actually a very low quality instrument. So you just have to do your due diligence. If you enroll into the SHARP program, it will teach you in greater detail all the different things to look at to spot and identify fraudulent or misleading surgical instruments.
Thank you,
Okay.
sir.
Has sent a question. First of all, she started with thanking you for the presentation. So she said that the training are both important for all perioperative nurses, especially in developing countries like Nigeria. So she hoped that the training will be made available, accessible, and affordable to nurses in Nigeria.
Yes, and that's what, as I mentioned before, that's why we started this organization. We set it up to be accessible and affordable for all countries or for all hospitals in low resource settings. And so that's why we do the things that we do. That's why we offer these discounts for a tour to make it even more accessible than what we've already done. We've taken that a step further with our partnership and membership with TORG to make sure we can make it more accessible and more affordable for nurses in Nigeria and in other parts of the world.
Thank you very so much once again, Mr. Miles. Your presentation is so impactful and educative.
Thank you.
We hope that we invite you next time for another webinar. You'll be available.
Sure, happy to help.
Okay, thank you. I don't know whether anyone has any more questions.
Okay, thank you very much, Mrs. Florence, for that wonderful section. And Mr. Aliu Danjuma, please, can we move on, please? Mr. Danjuma, are you still on, please? Okay, as we wait, Mr. Danjuma, I want to invite the founder of TORG, in person of Mrs. Adebusola, for a brief enlightenment on this STERI SHARP program and to give us more brief summary of it. Please kindly welcome with me the founder, in person of Mrs. Adebusola Okole. You have the floor, ma.
Thank you so much. It's been wonderful so far. Thank you to the team for organizing this session. I want to say thank you to Mr. Miles for the insightful presentation. Thank you for the partnership. And fortunately, we've got 2 memorandums of agreements signed with Mr. Miles. One is for SSI, which is the Safe Surgery Initiative, and then for the innovations as well. So we've got 2 agreements with 2 great organizations coming from him. So that is a significant achievement. On behalf of the Operating Room Global Executives Board of Trustees, I really want to say thank you. And for the generous discount that you gave to TORG members, thank you so much. I know you really went all the way down below standards just to make sure that it's affordable and accessible to all. Anything good, well, it's good anyway, but a lot was invested into that. It can't be free. There's no way it can't be free. It can't be free. It's the first of its kind, especially for low and middle income countries. In TORG, we've got, as of today, we've got 106 countries represented. We have 30 out of those from Africa alone. We have significant number from Asia. So we've got so many people, so many hospitals that we really need the program. Either it's STERI, either it's SHARP, everyone in every institution, there is operating room. And if there is operating room, there has to be a CSSD. Either it's modular or it's in a separate department, there has to be something. And surgeons, perioperative nursing team, surgical technologists, they can't do without surgical instruments. Even anesthesia providers, they have to use it. Perfusionists, even if it's just one or two, they have to use a clamp, they have to sterilize something, either it's for induction, either it's for preparation. So it's needed. And if hospitals can actually look into repairing what they have or maximizing the use of that instead of everything getting spoiled over time, they can't replace this, there's no funding. But if they look inwards, empower their own staff. I'm saying this because I know a lot of people are watching now, and there are directors, there are people who are clinical directors. Some people here even have their own hospitals. So, and they can also consider this. If it's just one staff member, for example, you hire a perioperative manager, you can push the agenda forward. You can speak to your management. Oh, I heard about this STERI and SHARP program today. I want to enroll someone. Or if it's not the entire member in your facility, it could be just one person to start with or two people to start with. And it's not really expensive. If you discuss with the team members, the sterilization team, they can tell you, they can issue the discount codes for enrollment, and it's online and offline as well. So you can access, as he mentioned, there is certification. The certification is international standards, as you heard in the presentation. That means if you are certified professionally, you can use that certificate anywhere in the world. You know, I know from where I'm coming from, Nigeria, and from other countries as well, I've seen that most people, most facilities, they get trained on the job. I mean, for surgical instruments, they get the training on the job. There is no standardized training to say, oh, this is dedicated for sterilization techniques or this or that. And even people that work in CSSD, even though it could be managed by a perioperative nurse, most of them don't even have certification. They just get trained on the job. They don't really know what to do. And there is no guarantee that what we say it's sterile, it's actually sterile. So we need to look into all these things. It was one of the issues that came up at the last conference in Nigeria, the inaugural scientific conference. This sterilization issue was a massive one that we needed to look into. And the issue then, the perioperative nurses, they raised it that in the surgical environment, the scrub nurse would have to wash those instruments before it's been passed on for sterilization. The turnover time is affected. The next case is affected. And how can that same scrub nurse have the same mindset or in 100% capacity to scrub for the next case? And most times it could be two people in the operating room. There is a long list. They have to one person keeps scrubbing and scrubbing for almost 6 cases. Before you know it, there is no breaks. One gets really worn out. So I think, so if we have a training like this, first of its kind for low and middle income countries, and people can access that at convenience, either it's online or offline, I think it's a really, really good one. And there is CEU credits. Not just training, there is certification, there is membership with the professional body, and that membership needs to be renewed. According to the presentation I learned for today, and that membership needs to be renewed every year. I think it's a really good one. And for the SHARP program, even though it's more expensive, he mentioned that it comes with a toolkit. That toolkit has over 50 tools. I could recall all the points in the presentation now. The toolkit is expensive, shipping that to the country that's where it's going to be needed, it's something. So you have to put all of those things into consideration. And that toolkit remains at your facility. It's permanent with you. It's not something that is going to be collected. Plus the training, which is 12 weeks, and it's hybrid as well. You get opportunity for 4 weeks online, 4 weeks practical, and the evaluation another 4 weeks. There is no way that that person who undergoes all those steps is not going to be competent. So I can guarantee that, and even it increases the credibility of your facility that, oh, in my facility, I can boldly say that we've got 2 competent members who are licensed internationally to anchor our sterilization programs. You can stand anywhere. You can include that on your CV. You can, I mean, there's a lot of opportunities. I can go on and on and on. So I must say thank you so much, Mr. Miles. Definitely, if we have people coming back, because there will be lots of questions after this, maybe people sending emails to TORG or to the sterilization team that want to get enrolled, we will get back to you. And if there is a need for us to have another session, maybe to clarify more, or maybe to explain again, because sometimes people might need to be reminded over the next few weeks. So maybe we'll bring you back again if that would be convenient for you. So thank you so much for the opportunity. And I really want to say thank you to the sterilization and infection control team for organizing this session. They've really done a lot and they are raising the standards. I can say that 150%. Thank you so much, from Mr. Emmanuel, which is the chairperson, to Mrs. Precious, the secretary, to all the team members. They've been fantastic. These guys are leaders. They are leaders in their own facilities, and they are raising the standards in terms of sterilization and infection control. So thank you to the team. I know we have surgical technologists also joining this session. Most of it, like in Pakistan, for example, TORG Pakistan, I could see Mr. Abubakar connected, is the vice chairperson of TORG Pakistan chapter, is a manager in CSSD, I think, and operating room as well. Most of our members in Pakistan, we've got 90% who are surgical technologists. Some of them have masters in sterilization techniques. They have PhDs in sterilization techniques, and they are actually interested in the program as well. So definitely, it's not just Nigeria. It's something that cuts across every field. So if we have people coming back, we will definitely get back to you. And they can also contact the sterilization team members in Nigeria, leaders in Nigeria. And we can even organize, if it's a physical workshop, maybe we will have to bring you, Mr. Miles, to Nigeria for a physical workshop. Maybe we can have like a session integrated with one of our upcoming conferences, so that we can have a physical workshop or something like exhibition, so that people can also know more about what it entails in person. So thank you so much. I want to say thank you to everyone that connected from all over the world. I know, depending on your time zone, permit me to say good morning, good evening, or good afternoon, or good night to those who are about to sleep. And next week, I think we have another webinar that would be anchored by the Sierra Leone chapter. So it's an evidence-based webinar, and it's research-based as well. So we have the training continuous, and there is CPD credits always provided for TORG training. So thank you, everyone. Thank you for connecting. Thank you for participating actively. Feel free to reach out anytime. If you want to know more about the program, you can reach out to me, and I'll just I'll pass you on to the person in charge from the sterilization team. If that would be more convenient for you, just let us know whatever you need. We will be happy to support you. For the certification for this session, there is an evaluation form that is going to pop up on your screen. It's automated with Zoom. So that is why when you close the session, it just goes straight to your internet browser, maybe Google Chrome or Explorer or Mozilla Firefox, and then you will see the evaluation. We just wanted to fill in a few details. Let's know more about you. Let's know what you gained from the session, and let's know how it's benefited your practice in every way possible. So thank you, everyone. See you next time, and bye. Thank you. Thank you so much.
Thank you,
Thank you,
everyone.
Miles.
Thank you.
You're welcome. Bye.
Everyone.
Bye. Bye.